Hello, everyone. Welcome to this Lancet webinar on climate change and child health, presented in partnership with the International Pediatric Association. My name is Esther Lau. I am the editor-in-chief of the Lancet Child and Adolescent Health and one of the co-chairs of the webinar. 2023 is an exciting year as we mark the 200th anniversary of the Lancet. We are taking this opportunity to shine a light on crucial health issues, focusing particularly on 5 themes that we call spotlights. These are universal health coverage, health and climate change, research for health, mental health, and child and adolescent health. This webinar is part of the Spotlight on Child and Adolescent Health. And over the next hour and 20 minutes, we will explore the effects of the climate crisis on children and young people's health and well-being, the central role of the child health community in advocating for climate justice, and how different sectors can collaborate more effectively to bring about positive changes. We will first have a panel discussion, followed by a Q&A session and some closing remarks. You are welcome to submit questions throughout the webinar by using the Ask a Question box on the dashboard. On the webinar dashboard, you will also see a box with related Lancet 200 resources and a link to our Spotlight content that takes you to the lancet.com. You can adjust or minimize any of the boxes on the dashboard to suit your preferences. This webinar will be recorded, and a link to the on-demand version will be emailed to all who registered. Please also join the conversation on social media using hashtag Lancet200. Before we get going, let me introduce my co-chair, Hamaiyal Sana. I've had the privilege to work with Hamaiyal in the past few years since she joined our youth advisory panel. She is a recently graduated medical student from Pakistan and is currently a Paul Farmer Global Surgery Fellow at Harvard Medical School and the first ever Vice Chair of the WHO Youth Council. I will now hand over to her to set the scene for us. Over to you, Hamaiyal.
Thank you so much, Esther, and thank you so much, everyone, for joining our webinar today on the Lancet 200th anniversary. So to start off, I just want to say that youth and children make one of the biggest demographics of the world right now. And as such, they are one of the most vulnerable populations that are affected by climate change. So as a report that was shared by UNICEF a few years ago, it said that almost 1 billion children are at extremely high risk of getting the impacts of climate change. To start with, the effects of climate change manifest through lack of access to essential services like water, sanitation, and healthcare. But later on, it disrupts their entire environments. The children are being exposed to dangerous environments like food scarcity, poor education. They cannot access their developmental milestones, their prospects for future of having safe employment and safe living situations is very much disrupted the more we move towards exacerbated climate crisis. Over the past decades, we have seen that children and young people are presenting more and more with chronic diseases. Some of them are asthmatic attacks, as respiratory diseases, or it could be something even worse that becomes genetically implemented in their whole generational prospects of these children. We are also seeing that more and more patients are coming with adverse outcomes of benign diseases. We are also seeing pregnant people coming with worsening outcomes. We are also seeing bigger and bigger issues of mental health problems in these young people and children. And overall, we are seeing that these young people are becoming more and more anxious and insecure as they are growing in this environment that is becoming more and more hostile for them as they are growing older and seeking the support that they need, but is unfortunately not available. So today's webinar would be a very good way for us to understand how these inequities and disparities are manifesting in each sphere, because as I just mentioned now, it is not just limited to health or maybe to just one part of a child's life as they grew up. It is an intersectional problem that needs an intersectional solution. So today's webinar would be a great way for us to start the conversation, but also come to solutions on what we can do to provide these kids with the support they need, and also ensure that they grew up in an environment that is supportive of them and allows them to grow into their potential. So with that said, I hand over the mic back to Esther.
Thank you so much, Hamaiyal, for raising these important points. I'm excited to move on to the panel discussion, and we are delighted to be joined by 4 esteemed panelists. First, we have Professor Purnima Prabhakaran, who is Head Environmental Health and Director of the Center for Environmental Health at the Public Health Foundation of India. She trained as a physician and has been in public health practice for 2 decades. She recently served as chair of the research subcommittee in the WHO Civil Society Working Group for Climate Change and Health. She is also a member of the board of directors of the Global Climate and Health Alliance and co-chair of the steering group of the Health and Climate Network. We will also be joined by Dr. Samantha Adut, a pediatrician in Virginia, USA, and an assistant professor of medical education at the University of Virginia School of Medicine. She served on the American Academy of Pediatrics Council on Environmental Health Executive Committee and is on the board of the Virginia chapter of the American Academy of Pediatrics. She is also chair and co-founder of the Virginia Clinicians for Climate Action. Next, we have Ms. Ashley Lashley, who is a UNICEF youth advocate and Miss World Barbados in 2018. She established the Ashley Lashley Foundation to increase awareness of major social, environmental, and health issues, particularly in small island developing states, and founded the HEY campaign, which stands for Healthy and Environmentally Friendly Youth, a Caribbean initiative on climate change and health with a global outreach of over 100 young people. Finally, we'll be joined by Dr. Naveen Thacker, head of the health unit at the International Rescue Committee. He practiced medicine in Ethiopia and is assistant professor of population and family health at Columbia University, an affiliate to the Johns Hopkins University Center for Humanitarian Health, and a member of the Gavi Vaccine Alliance Partnership Team and the COVAX Leadership Group. As we have heard from Hamaiyal, the climate crisis is the biggest threat to child and adolescent health. However, some groups of children and young people are more affected by the climate crisis than others. So I would like to kickstart the discussion by asking all our panelists, which groups of children and young people deserve more attention? Let's start with you, Samantha.
Well, I'd like to discuss a little bit the risks to infants who are particularly at risk due to their physiologic and cognitive immaturity. I'd say that the risks to infants are different in the United States, where I practice, than in countries where malnutrition and nutrient deficiencies pose a major risk. But in the United States, infants are also at risk beginning in fetal life. Exposure to high temperatures and fossil fuel-related ambient air pollution increases the risk of adverse birth outcomes, such as preterm birth, which pose risk to child health and development, which can be lifelong. Infants also have significant vulnerability during extreme weather events. They are completely dependent on adults, and so are vulnerable also to effects on their caretakers, to the caretakers' health, safety, and security. So it gives them a kind of double vulnerability. They also have unique nutritional and medical needs and access to infant supplies. Formula, diapers may become unavailable following weather disasters and disruption in supply chains. And also, infants may not be old enough to have developed full immunity or to have received all of their vaccinations. And so they can be at risk of vaccine-preventable diseases in crowded conditions, such as measles, and simply because they aren't old enough to have received their vaccines. In Virginia, where I practice, elevated heat is one of the most significant climate risks that we are currently experiencing, and infants are at particularly high risk from extreme heat, second only to the elderly. And the other group I want to touch on is children with complex medical needs. Children in my practice may be dependent on healthcare system access, on electricity access for the most basic needs, their nutrition, their mobility, their breathing. And when access to electricity and healthcare is disrupted because of climate extremes, these children are at significant risk because of this interrupted access. They also may not be able to easily evacuate ahead of extreme weather events. And then the last group I'll touch on is children with asthma and allergies. This is one of the most common chronic conditions that I face in my practice. And these children are some of the most at risk from decreased air quality, whether it's from increased temperature or from wildfire smoke, which even in Virginia has posed a risk from smoke from across the nation. In Virginia, higher winter temperatures are also causing the allergy season to come earlier. And we know that that early spring onset is associated with increased hospitalization for asthma. Here in Virginia, we actually are already seeing an elevation in our tree pollen count now in February. And this is something that I, as a pediatrician, all pediatricians in our area need to be cognizant of.
Thank you, Samantha. It's so interesting to hear about your practice. I want to turn to Purnima and hear from her about sort of her take on this question.
Yeah, thank you, Esther. And I'd like to start by saying congratulations to Lancet on turning 200. I think I completely agree with Dr. Samantha about the infant being the biggest and the most vulnerable of the child and adolescent age groups. But I want to take a public health perspective and say, because of the close overlap between the climate issue and the air pollutants, I think I would zero in on air pollution and cities and regions of the world where there is deteriorating air quality. The children are the most vulnerable. And I say that because of the compelling evidence now that we see on exposure to air pollution having wide-ranging impacts on literally every body system. So not just respiratory illness, as we would intuitively think exposure to poor air quality means respiratory illness, but it's also a wide-ranging impacts on various other body systems, including child growth and development, cognitive development. So I think we're talking about our whole future demographic dividend being impacted by exposure to poor air quality. And in terms of the highest vulnerability, I think it's children living in the vicinity of industrial clusters and coal-fired thermal power plants. I think those vulnerable communities and the children living and working and playing there, I think those children are the most vulnerable in my opinion. So I think we need to focus on those hotspots, if I can say.
Yeah, thank you for raising these hotspots. I think another area is probably the humanitarian setting. So I want to turn to Mesfin for his take on this question.
Yeah, thanks, Esther. Just, to start with, of course, I work for the International Rescue Committee, and our work is mainly focused on people affected by conflict and humanitarian crisis, and including the climate crisis. So, climate change is of great and growing concern for the health of the people that we are serving. And I want to focus on young children who deserve more attention for various reasons. I think the speakers before me have already spoke about the physiological, vulnerability of why young children, infants, are vulnerable to climate change, and including their small size and rapidly developing brain and bodies, which creates, unique vulnerability to climate change. So it's also important to note that, climate change also creates outsized impact on children living in communities with least resource to adapt. That is including children affected by conflict. And today, throughout the world, climate change is having huge impact, and the Horn of Africa and the Sahel region of the Africa region is experiencing the worst drought and causing unprecedented level of child malnutrition. So yes, climate change affects the pattern of disease and other vulnerabilities, but in humanitarian settings and this fragile context, there are few risks greater to child health than malnutrition. So just to remind people, today roughly 1 in 5 children under the age of 5 years are stunted, and more than 50 million children are under 5 are acutely malnourished. So and also undernutrition is linked to nearly half of all child deaths. So despite the progress that we have made over the past 3 decades in terms of reducing child mortality, but malnutrition is still the major driver, and it is mainly driven by climate change. So climate change is only exacerbating the crisis, which we see severe and prolonged drought and extreme weather events, disrupting the agricultural activities and driving food insecurity, hunger, and malnutrition. So, and also greenhouse gas emission reduce the nutrient value of staple crops that provides the bulk of children's diet globally. So, not only the quantity of food and the quality of food that provide nutritious diet for children is also reducing. So there was data recently published on the Lancet that from 5 West African countries, which found out that extreme heat increased the prevalence of both chronic and acute malnutrition in young children. And also pregnancy outcome also worsen with nutritional deficiency associated with weather extremes, particularly in subsistence farming communities. So there are examples from Kenya and other places, how hot spells of 1 or more months contributed to food insecurity, malnutrition, which was associated with lower birth weight of children of subsistence farmers. So we must get, better addressing child nutrition, specifically those who are suffering malnourished, whether stunted or wasted, with life-saving both prevention and treatment solutions. So, in the context where I work, young children deserve increased attention. They are particularly vulnerable, and that is, was where our work and most of the focus we have been doing in terms of building solution as well as doing research to address the most cost-effective way of reaching these children in humanitarian settings. Thank you.
Thank you, Masvin. We have heard a lot about infants and young children, but let's not forget about the adolescents as well. So I will turn to Ashley. As a youth advocate, what's your opinion on this question?
Yeah, definitely, Esther. Thank you. And I join everyone in celebrating Lancet's 200 years. But I would like to touch a bit on youth mental health and eco-anxiety. And I remember through the Hey campaign in which I started, we were having one of our Hey Global Youth Climate Action Summits that focuses on climate change and health. And one of our Hey ambassadors from Dominica really highlighted that when Hurricane Maria, destroyed her country, it had an impact on her mental health and her family's mental health. So when I reflect back on that, we were only focusing on the physical health of human beings, but then I honestly got a better understanding of the mental health impact as it relates to the impact that the climate crisis is having on our lives. So climate anxiety is a particular problem that is growing very quickly alongside the general rising mental health crisis amongst many adolescents. And eco-anxiety is a genuine issue, especially for many children and teenagers who worry about their futures. And to keep it with my foundation, the Ashley Foundation, here in Barbados, we held a youth consultation with students from more than half of the island secondary schools to hear their opinions of how the climate crisis is affecting Barbados and their lives. And although more than 70% of people students who participated and adolescents are very aware about the major threats that result from climate change and their effect on our marine ecosystems, fisheries, agriculture industries, our livelihood, and our health, 92% of these adolescents believe that environmental issues like climate change are not being taught enough within our overall school systems. And then from that, we also conducted a preliminary finding through the Hey campaign, where 97% of people really believe, adolescents, that the climate change crisis is real, where the majority of them were citing the very negative effects but as it relates to poor academic performance, was one of the ways that many people between the ages of 30 and 17 really show the detrimental consequences of climate change on their mental health. So in my opinion, Esther, many young people really indicated that the government's inactivity on climate change had caused them to experience severe pain, a sense of betrayal and mistrust. So climate action is a clear way that we must protect mental health. So there needs to be a heightened or greater level of integrated climate change considerations into policies and programs for mental health, including mental health psychosocial support to prepare better and adapt better to the response of the climate crisis. And we need to see far more research into mental health and to develop a better understanding of and response to the emerging concepts that we're seeing globally around the mental health concerns and outcomes as it relates to climate change.
Thank you, Ashley, and thank you to everyone for sharing your insights. As we have heard, climate change has wide-ranging effects on child health, and pediatricians are uniquely placed to help children and families navigate these effects on their health and well-being. Samantha, I want to come to you and ask, what advice do you have for pediatricians and other health professionals who interact with children and their families?
Well, in our practice, I believe that pediatricians have a role in both adaptation and mitigation. We need to understand the risks, the local risks in our communities that climate change poses to our patients, because these really are very variable across regions. For my practice in Virginia, climate risks are primarily related to rising temperature, reduced air and water quality, changes in plant and vector ecology, and significant mental health impacts. So we as practicing pediatricians need to recognize, understand our local risks, and then counsel our families so that children can remain safe from these threats. What does that mean for me in my office? Well, it means that in the summertime, I have to be extra cautious of counseling my young athletes about the importance of them taking precautions to stay safe from extreme heat. I have to recognize which medications may put my patients at increased risk from extreme heat. And also now I have to start counseling my patients today on the need to start prophylactic medication for my allergic asthmatic patients so that they don't develop asthma exacerbations. We also can help our patients understand how actions that they can take in their own lives promote child health and planetary health. Often what is good for the planet is good for children. And we can talk to our patients, incorporate into preventative care that walking or biking to schools or activities when it's safe both is good for their health and helps reduce air pollution, or encouraging children to interact with nature and supporting family choices to reduce meat consumption. I also want to stress the importance of the role of pediatricians in promoting environmental justice. You know, here in the United States, a single city can have very varied heat. And so one area of a city can be dramatically hotter than another, often related to historical racist housing policies in that city of redlining. So pediatricians can work with local groups that are working to plant trees in areas that have suffered from decades of underinvestment. There's a group in Richmond, Virginia called Southside Relief, which is doing this amazing on-the-ground work. And I think as pediatricians, we have an important role to play in engaging with them and supporting their efforts.
Thanks so much for the practical advice. Beyond the clinic, pediatricians and the child health community have an important role in navigating for climate justice, as you say. The American Academy of Pediatrics, the AAP, was the first major medical society to publish a policy statement on climate change back in 2007. And Samantha, you led the AAP Council on Environmental Health's technical report and policy statement on climate change published in 2015. So looking back, what successes have been achieved and what do you think we should do next?
So yes, I am so proud of my professional academy, the American Academy of Pediatrics, which has been a bold supporter of climate solution policies since, as you said, 2007. We really have been at the forefront of national clean air and climate solutions for many years. The AEP was also a founding member of the National Medical Society Consortium on Climate and Health, which now represents virtually all leading U.S. medical societies and half of U.S. physicians through their societies. And I believe that this collaboration of the medical community, of the national medical community in support of climate policy, is really a necessary component of our national transition towards systems that protect climate and health. U.S. healthcare is responsible for about 8% of our nation's emissions. So not only can the health system be part of the solution, we have to be part of the solution if we're to meet our goals. And I want to stress the great potential for local and state level group. One thing I've learned over the years is the many important climate policy decisions that are made at the state level. And the Medical Society Consortium that I mentioned has fostered the development of state climate and health groups in almost half of U.S. states, with tremendous regional diversity across the country. I'm chair of Virginia Clinicians for Climate Action. We started in 2017 with 8 members, and we now have over 500. And we've had yearly advocacy days where we advocate for Virginia state climate policies. We brought the health voice in support of Virginia's landmark climate policies. It passed in 2020 and 2021, the Virginia Clean Economy Act and clean car legislation. And we, importantly, this has been an opportunity for us to engage trainees in the advocacy process. They, in fact, have been an important role, played a critical role in our development of climate curriculum in Virginia and our successful support of state policy initiatives.
Thank you so much, Samantha, for that thoughtful response. So over the past couple of years, we are seeing very devastating impacts of climate change, especially in low and middle income countries. Climate catastrophes like floods, famine, heat waves, and environmental migration are raising questions on the physical and generational safety of children and young people in these settings. Purnima, I direct this question to you. With your experience in health policies in India, what do you think is the need of time in low and middle income countries, and where do you think the civil society comes in these efforts at the state and national level policies?
Thank you, Hamaiyal. Yes, I've had the opportunity to work very closely in India with the Ministry of Health and Family Welfare, as it's called. And fortunately, I think way back in 2008 is when the Prime Minister's Council for Climate Change was established. But conversation around health-centric climate policy began only about 6 or 7 years later, when in 2015, the Ministry of Health took up this initiative to have a national program for climate change and health. So there is a mandate for the government of India to evolve evidence-based policies, climate-centric policies that have health at the center of the conversation. And they speak to many of the domains that we have been speaking about in this webinar: heat-related adaptation response, air pollution-related response, floods, storms, nutrition, mental health, as well as the whole conversation around mitigation. So while national policies have the mandate for action at the state level, or the subnational level, as we would call it, health takes a different contour, because health is a state subject. But there is a mandate for states also to be addressing the climate change and health agenda. And in India, this happens in very different ways, simply because we're such a vast country. We're often called countries within a country, with the climate vulnerabilities being so different in different geographies within one country. So there is action that takes place at both national and subnational levels. The gaps that I would speak about are the absence of conversations across different verticals. So we do have a Ministry of Environment that also has a national program for climate change, but there's other ministries like the Ministry of Housing and Urban Affairs, which speaks to the climate action at city level. So what are we doing about child-friendly cities? Do we have urban and physical environments that facilitate or promote child health or adolescent health for that matter? That is the gap that I perceive, and I'm often trying to address, the conversations that need to happen across different verticals. And another important one is the Ministry of Women and Child Development, because that one directly addresses child welfare. So where is the conversation that needs to happen around the climate change adaptation with a child-centric lens is something that we are trying to address as well. I think in terms of policies at various levels, I think at the international level also, we've had a great movement and a momentum set up for health professionals to become advocates in climate policies. And I think whether it's the role of WHO or different health ministries around the world, especially in the last 2-3 years, I think the conversation has been elevated to a different level where health professionals are speaking to the concept of the health, the climate crisis being a health crisis. And I think that momentum is something that civil society has also played a role in, to increase the conversations, bring climate to the center of the conversation and health at the center of all those climate policies. I think the last one that I would talk about is about training and capacity building of the medical fraternity, as well as, the nurses. Every health actor needs to have some sensitization around climate change and health. And I think policies that can address that portion of changing medical curricula around the world so that we are strengthening and empowering our healthcare professionals to step up to this challenge of addressing the climate crisis, I think is an important one in terms of policy making. Thank you.
Thank you so much, Purnima, for sharing your thoughts on this. So talking about civil society, Mesfin, you mentioned that you have been heavily engaged in understanding the patterns of climate change in humanitarian settings. In your opinion, what do you think is needed to bring relief to this disadvantaged group of children and adolescents? And what do you think the role of civil society can be in these efforts?
Yeah, thanks. I just want to, follow on that point. Certainly climate change is one of the top driver of humanitarian need, particularly for the poorest countries who have the least resource to adapt. And as I mentioned in my earlier talk, the number of people who needed humanitarian aid, including children who are acutely malnourished, and it's very high. So it's unprecedented. We have never seen such number. So certainly long-term and sustainable relief can only be achieved by tackling the driver of climate change, which is, reducing greenhouse gas emission. That is, the solution. But at the same time, of course, we need to invest in resilience and helping, smallholder farmers to adapt their agriculture. But these are also, long-term efforts that require coordinated action from government, UN agencies, civil society, and private sector across, the spectrum of sector, including economic development, agriculture, water sanitation, and health sector. While, the global agreement or the effort to reduce gas emission is necessary, but we must also help communities to adapt to the changing climate, which is already a reality for many people. And we need to scale up local disaster reduction effort and better incorporate effective intervention into humanitarian and development effort. So currently, the humanitarian and development work work in parallel. I think we need to recognize that these are not different places. It's the same communities who are exposed to humanitarian, this climate change effect, are also the same places who are struggling and to develop their community and rebuild their lives. So, from the health perspective, I think where I have the most experience is that access to healthcare is, of course, a cornerstone of the child health, and including providing adequate nutrition. There are, especially in humanitarian settings, where conflict is also another driver. People are displaced, living sometimes, in isolated communities. We need to adapt and build on community-based care model that are more distributed, which can afford greater resilience when extreme events occur. I think we have seen how community-based care model can deliver people even in the middle of pandemic. I think the COVID pandemic has taught us what can be done to decentralize care. So research, by our organization and several peer organizations shows that community-based care model, whether that is for treatment of common childhood illness or treating acute malnutrition, with trained and supported community health workers, can expand access to care. And many of the conditions people are experiencing are not complex situations that require complex treatment. It's really simple preventive and treatment approach that can be delivered through community health workers that would make a difference. So yes, we can do so more cost effectively, and we need to bridge, the knowledge gap, what works in this kind of situation. And we know that in our own study that by supporting community health workers, for example, on treatment of malnutrition, we can reach, a quarter of children with the same resource we are currently, spending on nutrition. So really, we have to be very effective and efficient in how we use existing resource. And of course, civil societies as implementing agency, we have a role to play, but at the same time as an advocate for putting in place the right policies and adaptation measures that are necessary to help these communities. And, that plays out, globally as civil society, using our operational experience and what works to help these harder to reach communities, but also at the national level, holding governments accountable and to implement the mitigation and adaptation strategies that are necessary to preventing this, the impact of climate change, and also helping communities to adapt. That include policies as well as how we finance this effective intervention, which sometimes don't get prioritized in the face of competing demand. So yes, I think the civil society have a role play for both as an advocate as well as implementing agencies. Thank you.
Thank you so much, Masfan, for those meaningful contributions. And talking about research, I cannot help but notice that as much as we are observing these disparities rising due to climate change, we are also seeing that there's a dearth of information or data available on the ways that climate change is affecting children and young people, and also a dearth of information on the possible solutions or interventions that can be successful or have been successful in alleviating the effects of the climate change in this demographic. Purnima, I direct this question to you to ask, what do you think can be done to upscale the research efforts to generate this essential data that can inform the policy solutions in these countries?
Yeah, thank you, Hamaiyal. I'd like to kind of draw on my recent experience working with the WHO and the Global Climate and Health Alliance in kind of mapping out the research gaps, as it were, over the last decade. So building on a report that looked at global research priorities for climate and health in 2009 that WHO had published, we looked at the decadal trend from 2009 to 2019 on not just the geographies where the research was happening, but also the trends over the decade. And not surprising that we found that this research was very inequitably distributed. Whether we are looking at thematic areas or the regions where this research was happening, it was very unequally distributed. We had some research around health impacts, some around health vulnerabilities, but less so in terms of the economic impacts or the gender-sensitive research. And I think what we found at the end of that exercise and in the report that we published afterwards, which was called The Gaps and Perspectives and the Way Forward for Climate Change and Health Research, was that much of these gaps were happening because of a couple of reasons. One was where the disease burden is highest, where I would call it the 10-90 gap. 90% of the disease burden is is in the climate vulnerable regions, small island developing states, the developing nations. Only 10% of the research is actually happening in those countries. So this 1090 gap is probably due to a number of reasons. One could be because of the research capacity itself. It could be because of research funding. So therefore, I think the gaps that need to be filled are probably a couple of things that need to be strategically thought about. One is building research capacity where it needs to be done. So a needs-based kind of gap assessment needs to be done, and research funds need to be infused where the research needs to happen. So in those countries where the evidence base is lacking, I think that's where the capacities need to be strengthened, the funds need to be infused. I think in terms of recommendations, we also talked about intersectoral collaboration. Oftentimes, climate change is such a multi-sectoral discipline that it often requires different people to come together. So partnerships for purpose is something that we've talked about. I think generating data is important, and once data is there, that needs to be shared to build those evidence-based repositories that will feed into effective climate policies. I'd really point people to that report and to read some of the gaps that we picked up in that exercise. Thank you.
Thanks so much, Munima. And you raised a really important point about moving out of our silos to collaborate more effectively. I want to turn to Samantha and ask, how can the research and health community work more closely together?
Yes, so I do think this is a very important issue. I see several main opportunities for collaboration. First, really, is education of medical students and trainees. Physicians have a great deal to learn from scientists who are researching the impact of climate change on plants, animals, ecosystems. That work is often the foundation for our understanding of climate change impacts on human health, but it's not generally within the realm of traditional medical education or research. My colleague, Dr. Hamaiyal, and I just were course directors of the UVA School of Medicine's Climate and Health elective, which just finished last week with fourth-year medical students. And we had speakers who were experts on vector ecology, waterborne pathogens, plant biology, water security, none of whom were medical doctors, but all of whose research directly affects human health. So this cross-disciplinary educational programming and collaborative research, I do think is very important to underlies our understanding of climate change impacts on the health of people. In addition, healthcare decarbonization really can't be achieved without collaboration. We need teams that include physicians, engineers, architects, lawyers, members of the business community, and this really can only be done collaboratively. And I do think that cross-disciplinary healthcare sustainability programs are critical to our success of decarbonizing the healthcare sector.
Thanks so much, Samantha, for these points. And I want to turn to Ashley. I know you shared a little bit about youth-led research. So I wonder if you could just share some more thoughts on how young people can be engaged in climate research.
Yeah, definitely, Esther. And I would just like to add on from Dr. Parama and Samantha as well, because they made some very important points. But as we all know, I believe that it is important for young people to be engaged and supported on when it comes to climate research, particularly since throughout this morning's discussion, we have heard that the climate crisis is one of the most important issues of our time. And I believe that young persons or young people's concerns and perspectives should be examined in that of youth-led research to encourage their involvement in empowerment within the fields that they're interested in. And in my opinion, youth-led research also really fosters that transformation by providing a critical foundation for the development of general concepts. So through the process of enabling children and youth to engage and address these issues in their immediate environment, it empowers our youth and our society. And the honest reality is that our young people are to be meaningfully engaged in the entire process when it comes to climate action. And I know Dr. Samantha mentioned collaboration, and collaboration is one of the most important drivers when it comes to meaningful engagement of our young people within any research-related fields. So there needs to be a heightened level of support for our young people within these research-related areas, and that of the capacity building and technical support in which we would require to develop and advance our variant advocacies and interests. Thank you.
Thanks so much, Ashley. I will pass to Hamaiyal for the next few questions.
Hello,
Yes,
am I audible?
I can hear you. Yeah.
Oh, perfect. Okay, so that was some really great contributions. And as we are seeing that an increasing role of young people in the spheres of climate negotiation, we observed that young people are becoming youth envoys of climate negotiations. We are also seeing them taking up leadership roles in the ways that they are talking with their ministries and their organizations. So what do you think are essential investments that can be done by UN organizations and countries and also civil societies to empower these youth that are working in these spheres? And what would you think the call of action should be for these youth climate activists in their efforts? And I would direct this question to you, Ashley, based on what you have already shared with us.
Yes, definitely. What we're seeing globally with young persons is really amazing. And we're seeing that young persons globally are rising up to take action for varying topics relating to climate and health and climate action abroad. But definitely youth across the world have a particular interest, in my opinion, when it comes to the challenges of climate change and the discussions that have been going on within the UNFCCC processes. And this interest and involvement has mostly been sparked through the slow-moving negotiations, which I call it, which are meant to prevent like dangerous anthropogenic interference with the climatic systems. And due to the intergenerational equality implications of climate change, youth have taken an active interest in the subject. I remember I attended COP27 last year, and I was able to witness more climate negotiators at COP27 this year rather than when I attended at COP28. So young people around the world are tremendous agents of change because they come with fresh perspectives. They come with a passion to learn, a passion for what they do, and competence. So UN organizations, nations, civil society must absolutely invest in the technical capacity and training to support our young people within this area of ongoing interest amongst us. And the reality is that our youth are actually leading the way when it comes to taking action for climate and health and for climate justice. And my call to action then, therefore, for other youth climate activists, funny enough, it would be related to one of my icons who I admire a lot, that of Nelson Mandela, where finally our deepest fear is not that we're inadequate, it is that we are powerful beyond measure. And I believe that, these words are still very powerful and relevant today when it comes to everything which we're discussing and the empowerment of our young people. So I believe that we should go to the end. We shall fight for climate and health justice. We should fight for the protection of the health of our seas and oceans as well. We should continue to fight with growing confidence and strength in the air, and we should continue to defend our countries. And we should never, ever surrender to what I call the climate crisis as that of our global public enemy. But at the end of the day, young persons must understand and realize that despite the many obstacles in which we're facing surrounding the climate crisis, that no obstacle should be greater than the cause. Thank you.
Thank you so much, Ashley. Those are some strong words and super motivational. So thank you so much for sharing them. And as a segue to that, now I'm going to pass off the mic to our other panelists to give us a short, I would say a segue or a short brief description from your experience on what do you think could be an effective way of working with young people in climate advocacy. How do you engage them meaningfully as partners in your efforts towards climate change? So I'm going to first give off the floor to Purnima.
Thank you, Hamaiyal. From my experience, I think I've had the good fortune of being in conversation with youth at many levels. So at my own institute, I interact a lot with public health students. So there's always conversation around climate and health, and they've become strong and sensitized in terms of talking about climate change and health. Similarly, we've had the opportunity to engage with medical students, given that climate change and health is not still a part of the curriculum, but we do talk to current medical students. So the Medical Students Association of India is very much in conversation with us. And fortunately, also the international, parallel of the medical students, the IFMSA with the International Federation of Medical Students Association, were closely involved with us in the WHO exercise that we did for research trends. So whether it's that or engaging with them at the COP conversations, I think they have a voice at the table. So I think collectively the power of youth was leveraged by us at several levels. I think we also put together a youth charter at the previous COP, in Glasgow. So youth, medical and health professionals signed up to a 10-point charter that we presented at the COP. So I think they're able to act both at speed and at scale. I think we have to leverage the power of the youth and give them a voice at the table. And I think every opportunity is available to them, and they've used it very optimally. So more power to them.
Thank you so much, Purnima. Samantha?
So the American Academy of Pediatrics Council on Environmental Health and Climate Change created positions for trainees on this council to ensure that youth voices are present in all of the discussions at that level. Similarly, the Virginia chapter of the American Academy of Pediatrics is actively promoting the engagement of trainees in the state. And within the group that I chair, Virginia Clinicians for Climate Action, we've been very cognizant of the importance of engaging medical health and School of Nursing and other allied health professional trainees in our work. For example, we supported the participation of dozens of trainees at our recent Advocacy Day in Richmond. And our students attended 50 meetings with legislators. So that they could actively participate in the advocacy process for state climate solutions. Our group VCCA gives out small grants to student groups. And as a result of that, some of these students have since gone on to really take their own initiatives. For example, they created a climate and health resolution for the Medical Society of Virginia, which was passed. And it was students who ultimately have created Virginia's Tatu School of Medicine Climate and Health electives at University of Virginia and soon at Virginia Commonwealth University. Both of those have been through student leadership. So it's clear that students are an integral part of our climate and health progress in our work in Virginia and nationally.
Thank you so much, Samantha. And now I'm going to give the floor to Mesfin for a short segue into how youth can be involved in climate advocacy.
Yeah, thanks. I think, my previous speaker already said many things, but I think, one point to emphasize that it's important that, the youth have the opportunity to participate in climate policy making as well as monitoring and, on the change efforts. So it comes down, nothing about the youth without the youth. I mean, this is, their future. And there is a great recognition that, intergenerational equity that has fueled the climate protest led by young people globally I think that's the driving force why young people need to be included in the climate justice work. So we must ensure that they are included, and a diverse group of young people from both upper and low-income countries have a say, and not just only a tokenized participation, but a truly participation. So just want to remind that a global survey of young adults, which was recently published, showed that more than half of surveyed young adults reported that they are very much or extremely worried about climate change. So this is a real issue that young people are feeling. So we cannot just assume that this is something that will be solved by just government, but I think the role of young people should be recognized, and they have to be provided the seat on the table. Thank you.
Thank you so much, Ms. Finn, and thank you to all our panelists for this rich and insightful discussion. I've seen lots of questions that have come in, so we will go through these in the next 20 minutes or so. A lot of questions are actually about kind of practical actions that people in different spheres can take, which is excellent to see. So the first question, and I would like to ask Samantha and Purnima to answer this, as you both mentioned air quality. So the question is that I struggle to convince fellow hospital pediatricians that they have a voice in advocating for better air quality. We have recently embedded UK postcode air quality data in our electronic medical records and hope this will assist the conversation. Have others taken a similar approach, and is it effective? Samantha, I'll come to you first.
Can I ask you to clarify the question for me?
Yeah, sure. So the question is about kind of how do you convince fellow pediatricians that they have a voice in advocating for better air quality. So the example given is that they have embedded UK postcode air quality data in their electronic medical record system to help assist the conversation. So thinking about the kind of practical ways of assisting with this kind of conversations. Yeah.
As I understand, thank you. So one thing I think is I find a little shocking sometimes is how little medical students learn about air quality and air pollution. Most U.S. medical students learn nothing about ambient air quality standards, about air pollution in the United States, not to mention globally. So it's really not something that they're taught or that most practicing physicians know just about anything about. So in fact, I think one of the first things is really providing education about why air quality is so relevant to the health of our patients, and just some of the foundational information, the most basic things about what is particulate matter, what is ozone, what are the criteria pollutants. So I think that's the first thing, really, is to help people, is to provide that education so that practicing clinicians understand why it's relevant. And the next step is to taking action to address poor air quality, whether it's in our offices or in advocacy efforts.
Great, thank you. Purnima, do you have anything to add to this question?
Yeah, I want to share a similar, program that we run, actually leveraging a network of hospitals that we work with. We actually have what we call the CHAMP program, which is Climate and Health Air Monitoring Program. So we have monitors, TV monitors, which are set up in the waiting rooms of the hospitals, which display the air quality of the location. And we superimpose also information, IEC material, information and education material on the health impacts of air pollution on various populations, women, children, the elderly. And that is actually in several regional languages as well. So that's helping to create this groundswell of awareness around air quality and its poor air quality and its impacts on health. So doctors and healthcare professionals working in those healthcare facilities are not just aware of the air quality in the region and are able to speak to their patients, about the preventive aspects of for preventing illness due to exposure to poor air quality, but we are also seeing that patients and their attendants are getting sensitized about air quality issues. I think this is an important awareness building program that we are trying to leverage here in India, and I think it's a practice that can be replicated in very many settings, maybe in schools, maybe in other kind of facilities as well.
Thank you.
Thank you so much, Purnima and Samantha. Those were some really amazing contributions. So as you can see that health impacts are clear, and I'm very pleased to pose this question from our audience to Mesfin, probably to you. So what do you think is the role of pediatricians and public health practitioners in giving evidence in court action to hold the governments and the private sector accountable for their actions, or you could say their inactions? And what do you think is their role in direct action, such as supporting civil disobedience campaigns? For example, the HIV epidemic, we learned that public protest was needed to achieve the action that was required to do the mobility for action. So what do you think can be done? So Mesfin, the floor is yours.
Yeah, thanks. Certainly, I think mobilization of young people for issues that affect their future, their life, is certainly important. And I think, that's where the role of the schools come in terms of educating, and whether that's the science, and as well as, the right of the young people for a cleaner environment, and also for a right for the protection of their future. So I think, when young people are organized, we have seen how it has been impactful globally, and as well as local action. So yes, I mean, government has a responsibility to take action, whether that's policy related or even financing, adaptive measure and mitigation measure. So we can only do that if you have data. So that is where I think the partnership between research and activists, or those who are mobilized to take action, are important. So without data, we're just flying blind, as we know it in public health. So really, the research community, we have a responsibility to understand the impact of climate change, and also the impact of adaptive measure that's being implemented. How is that, the water purification or method that's being implemented would have impact, whether that's child health, or infant health. So unless we know those dynamics, then, every good intention, you may think that it will have a good benefit, but which may not always, the case. So really, I mean, the research community needs to step up to understand the differentiated impact of climate change on communities, those with more resources, those who have least resource. I focus in countries, low-income countries, who are disproportionately impacted, who also have the least resource to adapt. And I think without data, then we may not be able to help communities to advocate for their rights. So I do think, that bridging the research and the policy action gap is necessary, bringing the academic and the youth activists. Thank you.
Thanks so much, Mesfin. There are two questions from the audience about young people's involvement. So the first one is about the practical ways that young people could engage in research. And the second question, which I think is for Ashley in particular, is that you brought up the issues of gaps in education on climate highlighted by students. What kind of specific improvements did young people ask for? Would you mind answering those two questions, please, Ashley?
Yes, definitely, Esther. So in the question relating to research, the practical ways in which I believe that young people can be engaged in research processes is that, one, they can identify the research issues and questions that professional researchers may have missed and not prioritized. We often know that young persons have their own individual topics that they would always like to see discussed, but they're not always at the forefront of the majority of climate and health conversations in which we're seeing today. Young persons and children as well can help to ensure that these research tools like questionnaires and leaflets, reports, etc., are worded in a language that is clear to their peers, we often notice that most of the information that we're seeing in reports and that we're seeing in varying research methodologies that are being conducted, they are not children sensitive or child friendly. And I think more emphasis should always be placed on the language and how the inclusion of language is communicated to young persons, but not only young persons, but young persons living with disabilities and persons of varying demographics, to ensure that the climate and health messages is very inclusive. I often think too that young persons can offer a different perspective when it comes to research and the questions that should be asked to the varying respondents. And young persons can always lead the way when it comes to carrying out the varying research or data related surveys. But in order for all of these items in which I mentioned can be achieved, there needs to be a heightened level of technical capacity and training towards young persons, and to really find varying stakeholders and government individuals to provide our young people with the necessary new skills and techniques that they can have to actively and be meaningfully engaged when it comes to possibly becoming a young researcher. I know here in Barbados, currently too, through the Barbados Youth Climate Action Summit and Expo, which I started last year, we're looking at varying ways in which we can continue to share the sensitization message to see the varying jobs that are within the climate and health related spaces that young persons can always participate in. So that of meaningful engagement is extremely important when it comes to young persons engaging in research or even climate action related topics in general. But through the Barbados Youth Climate Action Summit and Expo, which took place last year, I know your second question was relative to what were our young people calling for, referencing to that activity. And funny enough, we ended up after that consultation doing a call to action to the government of Barbados. And one of the call to actions were that there needs to be a greater or increased level of youth stakeholder engagement on environmental issues throughout our Ministry of Environment here locally. And it goes back to the further education and sensitization too of our local populace on environmental issues, and young persons understanding the role and the importance of sustainable development and the achievement and attainment of all of the sustainable development goals. So they were also calling for the need for an adequate regulatory framework and legislation to really incentivize viable fishing practices, because coming back to Barbados as well, being a small island developing state and knowing that small island nations are at the forefront of the climate crisis, they were calling for a major transition as well to the fossil fuel dependency that we have to that of renewable energy. So one more example that I can possibly give of another solution through that youth consultation is that they were also calling for a greater incorporation of green spaces into our urban communities and especially in our schools, and the maintenance of those green spaces as well, Esther. Thank you.
Thank you so much, Ashley. That was a great contribution. So I'm going to direct the next question to Purnima. So going back to the risks that we just talked about that pregnant persons face, as well as their newborns and young infants, what do you think are possible or promising solutions or practices that you are aware of, particularly in low and middle income countries and communities?
Thank you, Hamaiyal. I think the first step was actually documenting that evidence, that pregnant women are vulnerable to issues like poor air quality or, in terms of waterborne diseases or, the different impacts of climate change, just the post-traumatic stress disorders. I think they are even more vulnerable at those stages in their lives. So I think in terms of good practices, I would say I think there's the increased awareness now, and therefore in regular practice, physicians and obstetricians are able to communicate to their, the people who they are seeing, that there needs to be a preventive and promotive aspect to health. It's not just about the regular antenatal care, but you need to take care about, preventing exposure to poor air quality and all the different, acute climate events and the impacts that they have on poor or ill health. So I think sensitization and awareness building is a big step forward, and I think we are working towards that goal of building awareness among first our healthcare professionals, because they are at the front line of delivering both preventive and promotive healthcare besides curative care. I think that's an important step in the right direction.
Thanks so much, Munima. Speaking about infants, previously we mentioned how we can specifically support mothers and infants in times of crisis. And in fact, we published the breastfeeding series in the Lancet recently. So I want to ask Mesfin about how we can support breastfeeding in these really challenging situations.
Yeah, thanks. Thanks for that question. Thanks for the participant who put that in the chat box. And certainly in crisis, even in any situation, infants has to be, supported to have, breastfeeding according to the WHO recommendation, exclusive breastfeeding as well as, continuous breastfeeding. But especially in crisis situation, I think infants are particularly vulnerable, and indiscriminate use of infant formula is very much discouraged, and I think we have to find a way of supporting mothers to breastfeed their children. And of course, not everyone wants to breastfeed. So we have to also identify those mothers and babies for various reasons who may not be, breastfeeding. So we need to have a formula that meets the WHO specification to be able to help those children who need formula. But in crisis situation, access to clean water is equally important. So if there is no clean water for mixing formula, then that could cause harm than good for the baby. So really we need to understand the operating context, ensuring that the mothers who choose to breastfeed are supported so that they'll be able to continue breastfeeding. Those who might have already stopped breastfeeding or and don't want to breastfeed also have the means to support them in a way that doesn't undermine other mothers who may want to continue breastfeeding. So really following the WHO recommendation, there is no such promotion of infant formula indiscriminately, whether in disaster and other situations. So that is the way we approach, and I think that must have been mentioned in the discussion, but that's not the intention. Thank you.
Thanks so much, Mesfin. There are a lot of questions that we won't have time to answer, unfortunately, but I do want to finish off this Q&A session by asking all our panelists one very short and practical question around the mental health of climate advocates. When we think about something that's so like an issue as big as climate change, we can often feel overwhelmed and we might lose hope. So the question is, how can we maintain hope and not lose momentum in our advocacy work? Mesfin, do you want to start?
Sorry, there was a little bit of blip. I lost you the last point, sorry.
Yeah, so the question is, how can we maintain hope as climate advocates and not lose momentum in our advocacy work?
Yeah, thanks. I mean, the problem looks big in the face, and certainly reduction of global greenhouse gas emission and reducing, the global temperature by 2 degrees centigrade looks, very big. And I think there are areas that need to be done in terms of reducing emission. We cannot just delegate that responsibility. Government need to take action. But we can also do that, in terms of adaptation and mitigation measures. And as young people and as well as, the society, we must seek justice and action through advocacy and climate action. And at the same time, changing our own behavior personally, how we do, how we travel, how we consume. Those will have, little impact, but I think collectively it will have big impact on our climate. So not to be paralyzed and take action what we can, and also push those policymakers to take the policy measure that's needed to have the necessary impact in terms of reducing global temperature.
Thank you, Mesfin. Can I come to you, Purnima?
Yeah, thank you, Esther. You did mention about the fact that this can get a bit overwhelming, trying to move the needle for the climate and health agenda. And I think I'd like to change the narrative to a more positive one and draw hope and succor from the fact that today we are much more aware that this is the problem, and we have a lot of knowledge and tools to address that problem. And I think collectively we have a lot of strength, and I think we have hope for action ahead, and I think that that's an important step in the right direction for all of us to be working together as climate advocates.
Thank you. Samantha?
Yes, I find a lot of hope in collaborative work with my colleagues, with trainees, and collaboration has been found to be very supportive of mental health of climate advocates, and I really try to focus on solutions and actions that I can take to be part of creating a healthy energy system and healthy society for youth, for all people, including next generations, future generations. And I also think it's important to recognize that sometimes this can get overwhelming, and giving time for being in nature and interacting with the natural world not only is motivating for continuing the work, but also is helpful for alleviating anxiety in myself.
Thank you. And Ashley, anything to add?
Yes, certainly. I think when it comes to hope and even addressing like the mental health concerns to hope, when it comes to coming from like a small island developing state like Barbados, I think for us as young persons, we are rising up to taking action for our environment in varying ways by starting our varying initiatives. Like I know here on island, we recently partnered and look at that multi-dimensional support when it comes to government, civil society, and the private sector working as one. And I think that is the best way in which we can have hope, is seeing that persons from all different types of backgrounds working together to solve and achieve one varying problem. Thank you.
Thank you. Thank you all for sharing your insights and experiences. We have covered a lot of topics concerning climate change and health today, and I'm glad that we can end this conversation on hope. So thank you again to the International Pediatric Association for their support. I'm delighted to have Professor Naveen Thacker join us for the closing remarks. Naveen is President-elect of the International Pediatric Association and Secretary of the Child Health Foundation. He is Director of Deep Children Hospital and Research Center at Garidam Kuch and Adjunct Professor of Pediatrics at Pramushwami Medical College, Karamsat, and at Gujarat, India. Naveen, over to you.
Thank you so much, Esther, and thanks for making IPA partner in this important topic. Congratulations to Lancet for completing 200 years. So today it is very important that you have met this climate change and child health. Otherwise, whenever we talk about climate change, people talk about temperature and negotiation and activism. So we have seen today there are so many things which can be done. So time for call to action is now gone. It is time for action. Time to act. And I fully agree with my colleagues, Samantha and everyone, Purnima, and I as a pediatrician see these things, how it is affecting the children's health. And but everybody does not know that. People, they don't know that it is because of climate that children are getting affected. So I think we have a lot of things to do, and we can definitely, we need a collaboration. We need to work together, and thanks for connecting all of us. I will just end up by saying what IPA is doing. IPA is a 112 years old organization from more than 150 countries and 165 societies. American Academy of Pediatrics is also our member. And if American Academy of Pediatrics can do and guide, why not other one more than 150 society can do? So what we are planning to do is, first, what we can do best. We have best do the advocacy. We have access to practically, as Professor Dr. Machi said long back, that we have access to every house because pediatricians are in unique position. So we can very well do advocacy. We have a convening power that we can bring all these societies to work together with other stakeholders. We already have a collaboration plan with WHO and UNICEF, where we will be doing knowledge sharing on environmental hazards and children. And as I said, much can be done, even just not activism, but also by sharing knowledge and making people aware. So we have this plan with the UNICEF, WHO. We have technical collaboration plan for joint products on children. We also will be disseminating global products like WHO, UNICEF, e-learning tools. And we are having a full plenary on children's health and environment in upcoming IPA Congress. We will be issuing a call to action and commitment, not only a call, but to commitment, where we will ask these societies who are coming to India and those who are our members to work on that. So IPA is fully prepared to work with partners, and thanks to Lancet for connecting us to all stakeholders. And we look forward to continue to work with everyone. Everybody has talked about what important role pediatrician can play, and we are fully prepared to play that role, and time is now. I think, thank you very much for bringing attention to the child health, because as I said, there is a very little focus on how climate change is affecting the child health. And thanks to bringing all of us together, let us work together and let us not lose hope. As someone said, it may not immediately, you may not change the temperature immediately, but you can definitely change lives of many of these due to many other reasons. So thank you so much again, Esther, and thanks to all the panelists for wonderful discussion. Thank you so much.
Thank you, Naveen, for this powerful call to action. And thank you once again to our panelists, Purnima, Samantha, Ashley, and Mesvin, and to my co-chair, Hamaiyal, for their participation. It's been a privilege to hear from speakers from such diverse backgrounds. I hope you found this webinar inspiring and that the messages are helpful to inform your work. Collectively, we have a lot of strength, and through collaboration and by focusing on solutions and actions, we can move the needle on climate justice. We will have more webinars and other events throughout the year. The next webinars are on the decriminalization of suicide on Tuesday, the 18th of April, and inequality in medical research on Wednesday, the 17th of May. Please do look out on the Lancet 200 and Spotlight web pages for upcoming webinars. You can also explore more about our 200th anniversary on the Lancet 200 website. Sign up to our update alerts and follow #Lancet200 on social media for the latest updates. Thank you again for all your participation, and take care.